are you today?
I'm okay. How are you?
Good. Thank you for asking.
Of course.
So I'll be your nurse today, and my name is Shane.
Okay.
So I'll take care of you for now.
Okay.
Can you tell me like what brings you in today?
Sure. My name is MP. I'm 65 years old, and I'm an African American woman. I was diagnosed with hypertension, and I'm just here for a follow-up visit. I was diagnosed 2 months ago, and then they prescribed me with a thiazide diuretic, which I actually stopped taking 2 weeks ago because it made me dizzy, and I found myself emptying my bladder a lot at the middle of the night. But I'm actually here because I'm afraid, because my mom died around my age with stroke, and I'm afraid of having high blood pressure. I don't drink, I don't smoke, so that's one of my priorities right now.
Okay. Are you able to tell me more about your family history, all that?
Yeah, so besides my mom dying at 65 with a stroke, my dad died at 67 with a myocardial infarction. My sister's alive and well. She's living at 62 years old. And then my brother, he's living at 70 years old, but he has hypertension, he has diabetes mellitus, as well as coronary artery disease.
Okay. And what about yourself?
Well, for the most part, I've been healthy. I've been married for 45 years, and I have 2 kids, and I have 6 grandchildren. But at 45, I had a cholecystectomy and then a hysterectomy at 48 years old.
All right. So I got all the information, and then we'll take it from here, and then I'll be right back.
Sure.
Okay. I'm back.
Hi.
I just got all my stuff I need on, so I'm gonna go ahead and take your vital sign. Is that okay with you?
That is fine.
Okay.
Perfect.
All right. So then first I'm gonna take your pulse and your respiratory rate.
Okay.
Okay. May I touch you?
Sure.
Okay.
Should I take my watch off?
Yes, please. And just relax, okay?
Okay.
All right. And then next I'm going to take your blood pressure. How are you feeling?
Good.
You can relax.
You're a very good nurse, Shane.
All right. I got it all.
You don't need to put my heart rate. My temperature.
And then next I'm gonna take your temperature. Okay. All right, so that's all I'm gonna take, and then I'm gonna do a little bit of documentation, and then we'll go from there. Okay.
Hello, Miss MP.
Hi.
How are you today?
I'm good. How are you?
Oh, I'm good, thank you. My name's Sabri. I'll be your nurse for today. I see that you have high blood pressure. Do you have any questions, concerns regarding high blood pressure?
Yeah, actually, my mom died from high blood pressure, and that's the only thing that I know about it, is that it could cause death. So I don't really have much knowledge on it. And I'm
Okay.
just worried that that could potentially be me in the future.
Okay, well, I'm here to let you know that you shouldn't worry as much. It is concerning. It is concerning. It is related to a development of other cardiovascular disorders. However, with proper medication and being consistent with your medication regimen will help reduce the risk factors of the high blood pressure, such as a heart attack, a stroke, or congestive heart failure, or even kidney disease. Okay. You know what your range for your high blood pressure is right now?
I believe Nurse Shane took my blood pressure earlier, and he said 160 over 102.
Oh, okay.
Am I dying?
No, you're not dying. It's just at a very high stage. It's on the second stage of the high blood pressure. All that it means is that the blood pressure in your arteries, the force is too strong. The brief pathophysiology of hypertension is relatively persistent to the increase of blood pressure in the arteries. It is related to the development of cardiovascular disorders or with any other factors. Now, what are the classifications of hypertension? Well, normal hypertension is systolic of less than of 120 and a diastolic of less than or equal to 80. Now, pre-hypertension systolic ranges from 120 to 139 and diastolic ranges from 80 to 89. Stage 1 hypertension ranges a systolic of 140 to 159 and a diastolic of 90 to 99. Stage 2 hypertension is a systolic of 160 or higher or a diastolic of 100 or higher. These classifications will have a modification of diet, increase exercise, lose weight, stop smoking, or take antihypertensive. What are the causes of hypertension? Well, one of the non-modifiable factors is age, gender, family history. Okay, Ms. MP, so I'm reviewing your chart, okay? And I see that you have a high blood pressure of 160 over 102. It is on the second stage, meaning that there's a lot of pressure within your arteries. However, with your proper medication and being compliant with your medication regimen should help decrease other risk factors that come with high blood pressure, such as a heart attack, a stroke, or even kidney disease. Okay?
Hello, Mrs. MP. How are you doing?
I'm good. How are you?
I'm good. I am Nurse Jessica. I'm gonna be discussing your lab and diagnostic tests. Is that okay?
That's fine.
Okay, so you have hypertension. There is no specific diagnostic test for that. So we will need you to monitor your blood pressure at least twice a week. So you could go ahead and have the nurses at your senior center monitor your blood pressure, or if you'd like, you could go ahead and purchase a blood pressure machine at CVS or something. If that doesn't work for you, you could go ahead and visit your local pharmacy and then have your blood pressure taken there. Is that okay?
I'll just have my husband do it. It gives
Okay.
him something to do.
Perfect. And we also got your lab results from your previous visit. So overall, the results were within normal limits.
Okay, good.
But we did notice that your serum glucose, it was slightly elevated. It was at 110 milliequivalents. So that is a slight increase, but based on your age, it's normal. So we don't really have to worry about that for now. So we will, because of your meds that we also have to we have to keep on monitoring your potassium levels, your sodium, and your creatine levels, okay?
Okay.
And I also noticed that you do have some family history of coronary artery disease. So because of that, we just to play it safe, we want to monitor your cholesterol levels. And do you have any questions?
Will I be given a pamphlet of all this?
Oh, yes,
Good
of
morning.
course.
My name is Florentino. I'll be your nurse for today.
Okay.
So we're going to go ahead and talk to you about your medications that you're taking for your high blood pressure. Is that okay?
That's fine.
Okay. So I see here that you've been taking hydrochlorothiazide, started 2 months ago. But it says here that you stopped 2 weeks ago, correct?
I did. Because I was feeling dizzy.
Because you're feeling dizzy. Okay. So for that medication, Miss MP, it is normal for you to feel some dizziness.
Okay.
But if you, when you are feeling dizzy, I just need you to walk around or get up slowly. That way you don't faint or anything like that. HCTZ medication?
Yeah.
Okay, so the reason for that is it is a diuretic, Miss MP. So I suggest you taking that in the morning. That way, because it is to help flush out the extra fluid that you're holding on to. So if you take it in the morning, that way by the time you go to sleep, you should be fine. You won't have to get up throughout the night anymore.
That makes sense because I was taking it late in the evening.
Yeah, so it's going to make you want to use the restroom.
Okay.
Okay, so then the doctor has prescribed a new med for you. It's a Vinazepro, it's called. It's an ACE inhibitor. So it's just going to help you with lowering your blood pressure.
Okay.
Do you have any questions about this new medication?
Yeah, what are the side effects?
So the side effects for this one, you may have some nausea, some vomiting, and some slight chest pain.
Okay.
But all that's normal, so you don't need to worry about it.
Okay.
Okay. Any other questions?
No.
Okay. So I'm gonna go ahead and document all the medications that you're on, and I'll let the doctor know, and you'll be all set. Okay.
Sounds good.
Hi, Ms. MP. How are you?
I'm good. How are you?
I'm doing great. My name is Yahaira, and I'll be your nurse today. I'm actually here to give you more information in regards of your care plan.
Okay.
Okay? So, based on your history and your knowledge deficiency, I have come up with a plan, with a care plan. And this will help you to control your blood pressure. Okay? And I made it short. I made it just with, I made it shorter. So there's 2 interventions. So our first intervention is strategies for a low sodium diet. And keeping it dietary, low sodium, my rationale to this is that dietary sodium contributes to fluid retention and elevated blood pressure. So the higher sodium intake, your body will retain the fluid, and that creates your blood pressure to go high, even though you're taking your medication. Okay? That's going to be our first intervention. And then our second intervention will be establish a routine, a medication routine, considering activities and sleep habits. And our rationale to that is taking your medication consistency or keeping a schedule will minimize the chance of error, and it encourage better adherence with therapy. So you take it in the morning, you try to keep the medications every morning, okay? And my goals for you is for you will verbalize and understand the disease process and treatment regimen. Our next goal will be you will be able to identify the side effects, the drug side effects, and possible complications that necessitate with medical attention. And third and final goal that you will maintain your blood pressure with individually acceptable parameters. Okay? That will be our goals. And I see that you are taking 2 blood pressure medications. Your first medication is your hydrochlorothiazide, and it's 25 milligrams POQ every morning. So you take orally 1 medication every morning. That's what we need to keep, okay?
At the same time?
At the same time. And also your Vinazepro. That's your second medication, okay? Do you have any other questions?
You mentioned low sodium diet, so what does that pertain to?
So low sodium, we're gonna try to cook your food. Also steamed vegetables, grilled your chicken, your meats without any salt or any chicken bouillon. Don't add anything for now. So you can keep your blood pressure during within a good limit,
Okay.
a normal limit.
Sounds good.
Okay? And before you leave, I'll make sure I go ahead and give you a copy of your care plan. And if you have any questions, please don't hesitate to come back or to give us a call.
Thank you.
Thank you. I'll see you later.
Okay.
Bye.
MP comes in for a routine follow-up visit 3 months later. She continues to do well on her daily blood pressure drug regimen and participates in a senior citizen group walking program at the local mall.
Nurses, I feel very knowledgeable about hypertension and how to take care of it. I'm definitely going to be taking my medication on time just so I can lower my high blood pressure. You guys are amazing. I love you guys. Bye. Thank you.
Bye. Take care.
Those risks of hypertension. What are the signs and symptoms to watch out for? They are
Go.
Were we recording? 3.
One second.
Okay.
Thank you guys so much for all your help. You guys have been amazing nurses. I feel so much better now. And especially with all this knowledge about hypertension, I'm definitely going to be watching out. Can you see everybody?
Ready? Okay. Ready?
Yeah. 1, 2, 3.
Okay.
I don't even know how